Question 1. A client with chronic heart failure on a loop diuretic reports muscle weakness and fatigue. Which electrolyte imbalance should the nurse suspect? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hypokalemia. The concept being tested here is the common side effect of loop diuretics, specifically their impact on electrolyte balance. Loop diuretics, such as furosemide, promote the excretion of potassium along with sodium and water, which often leads to hypokalemia, or low potassium levels. The keywords loop diuretic, muscle weakness, and fatigue are classic symptoms of hypokalemia, making it the most likely electrolyte imbalance. For example, a nurse should always monitor a client's potassium levels closely when they are on a loop diuretic and anticipate the need for potassium supplementation. Remember, loops lose potassium, which is why muscle weakness is a key indicator to watch for. Question 2. A primigravida client at 38 weeks gestation is admitted with preeclampsia, exhibiting a blood pressure of 160/100 mmHg and +3 proteinuria. The nurse anticipates administering which medication? A. Oxytocin. B. Misoprostol. C. Magnesium sulfate. D. Nifedipine. Answer: C. Magnesium sulfate. This question tests knowledge of medication management for preeclampsia in pregnancy. The critical keywords are preeclampsia, blood pressure of 160/100 mmHg, and +3 proteinuria, which indicate severe features and the need for seizure prophylaxis. Magnesium sulfate is the drug of choice for preventing and treating eclamptic seizures in clients with preeclampsia, as it works to depress the central nervous system. While other medications might manage blood pressure or induce labor, magnesium sulfate directly addresses the seizure risk, which is the immediate life-threatening complication of severe preeclampsia for the client. Always prioritize client safety by knowing the primary purpose of medications in high-risk obstetric conditions. Question 3. The nurse is reviewing the morning lab results for a client with acute pancreatitis. Which finding requires immediate attention? A. Serum amylase 150 U/L, normal, 30 to 110 U/L. B. White blood cell count 12 500/mm superscript 3, normal, 4 500-11000/mm superscript 3. C. Serum calcium 7.2 mg per deciliter, normal, 8.5 to 10.5 mg/dl. D. Blood glucose 180 mg per deciliter, normal, 70 to 100 mg/dl. Answer: C. Serum calcium 7.2 mg per deciliter, normal, 8.5 to 10.5 mg/dl. The concept tested is recognizing life-threatening complications indicated by lab values in acute pancreatitis. While elevated amylase, WBC, and blood glucose are common in pancreatitis, severe hypocalcemia, serum calcium 7.2 mg per deciliter, is a critical and potentially life-threatening complication. Hypocalcemia in pancreatitis can lead to tetany, cardiac dysrhythmias, and seizures due to calcium saponification in the retroperitoneal fat. For example, a sudden drop in calcium can lead to neurological excitability and dangerous heart rhythms, requiring immediate intervention to prevent cardiac arrest. Always remember to prioritize lab values that indicate an immediate threat to vital organ function or a rapid decline in the client's condition. Question 4. A 9-month-old infant is brought to the clinic for a well-child checkup. Which developmental milestone, if absent, would be of most concern to the nurse? A. Saying mama or dada specifically. B. Waving bye-bye. C. Creeping or crawling. D. Drinking from a sippy cup. Answer: C. Creeping or crawling. This question assesses the nurse's knowledge of expected gross motor development in infants. At 9 months old, the critical gross motor milestone that indicates proper neurological and physical development is the ability to creep or crawl, which typically emerges between 6 to 10 months. While specific word usage, waving bye-bye, and sippy cup use are important, they are often later or more variable developmental markers. The absence of crawling could signal a significant delay in motor development and warrants further investigation. When evaluating development, always prioritize core motor skills that form the foundation for later gross motor achievements. Question 5. A client diagnosed with major depressive disorder states, "There's no point in trying, nothing ever gets better." Which is the most therapeutic response by the nurse? A. I understand how you feel, but you have so much to live for. B. Many people with depression feel this way, it will pass. C. It sounds like you're feeling hopeless right now. Can you tell me more about that? D. Have you been taking your medication as prescribed? Answer: C. It sounds like you're feeling hopeless right now. Can you tell me more about that? The core concept here is therapeutic communication, specifically using reflection and open-ended questions in mental health nursing. The client's statement, "There's no point in trying, nothing ever gets better," expresses feelings of hopelessness. The most therapeutic response reflects the client's expressed feeling, hopeless, and then invites further elaboration. Can you tell me more about that? This validates the client's emotions without minimizing them or offering false reassurances, allowing the client to explore their feelings more deeply. Avoid offering platitudes or immediately focusing on medication compliance when a client expresses profound emotional distress. Instead, create a safe space for them to share more. Question 6. A client is prescribed intravenous vancomycin for a severe bacterial infection. The nurse should be most vigilant for which adverse reaction during administration? A. Hypertension. B. Hypoglycemia. C. Red man syndrome. D. Peripheral neuropathy. Answer: C. Red man syndrome. This question tests knowledge of specific adverse reactions associated with vancomycin administration. Red man syndrome is a characteristic infusion-related reaction caused by rapid intravenous infusion of vancomycin, leading to histamine release rather than a true allergic reaction. Symptoms include intense flushing, rash, pruritus, itching, and sometimes hypotension, primarily affecting the upper body and face. While other medications might cause the other listed reactions, red man syndrome is uniquely and strongly associated with vancomycin. To prevent this, vancomycin should always be infused slowly over at least 60 minutes. Question 7. A nurse is preparing to insert a peripheral intravenous catheter. Which action demonstrates adherence to the principles of asepsis? A. Wearing sterile gloves for the procedure. B. Cleaning the insertion site with an alcohol swab for 5 seconds. C. Palpating the vein after skin antisepsis with a gloved finger. D. Allowing the antiseptic solution to air dry completely before insertion. Answer: D. Allowing the antiseptic solution to air dry completely before insertion. The concept tested is the application of aseptic technique during insertion. The keyword asepsis indicates the goal is to prevent infection. Antiseptic solutions require adequate contact time to be effective in reducing skin microorganisms, and this efficacy is achieved as they air dry. Cleaning for only 5 seconds or palpating a vein after cleaning with a non-sterile glove would reintroduce pathogens. While clean gloves are typically sufficient for peripheral insertion, the most critical aseptic step for skin preparation is ensuring the antiseptic agent has fully dried. Always allow the antiseptic to dry completely to maximize its germ-killing action before puncturing the skin. Question 8. A client with chronic obstructive pulmonary disease, COPD, is experiencing acute dyspnea. The nurse notes the client is using accessory muscles to breathe and has an oxygen saturation of 88% on room air. What is the priority nursing intervention? A. Administer oxygen via nasal cannula at 6 liters per minute. B. Encourage the client to cough and deep breathe. C. Place the client in a high Fowler's position. D. Prepare for endotracheal intubation. Answer: C. Place the client in a high Fowler's position. This question evaluates the nurse's ability to prioritize interventions for acute respiratory distress, specifically in a client with COPD. While oxygen is crucial, administering 6 liters per minute of oxygen to a COPD client can suppress their respiratory drive, and the immediate priority is to optimize their natural ability to breathe. The most immediate and universally beneficial intervention for dyspnea is to position the client in high Fowler's, which maximizes lung expansion and reduces the work of breathing by utilizing gravity. After positioning, the nurse would then assess oxygen needs carefully, often starting with a lower flow or a Venturi mask, and then consider other interventions. Always remember to optimize the client's position first to improve ventilation before applying other interventions. Question 9. The nurse is assessing a client admitted with unstable angina. Which statement by the client would be most concerning? A. My chest pain feels like a heavy weight and started when I walked to the mailbox. B. I've had this dull ache in my left arm for the past 2 days. C. The pain woke me up from sleep and is now radiating to my jaw. D. My indigestion has been acting up, but antacids aren't helping. Answer: C. The pain woke me up from sleep and is now radiating to my jaw. This question tests the nurse's understanding of concerning signs of cardiac ischemia, particularly in the context of unstable angina. The keywords unstable angina imply a changing pattern of chest pain, and the most concerning detail is woke me up from sleep and radiating to my jaw. Pain occurring at rest, like waking from sleep, and radiating to the jaw are classic, severe signs of acute coronary syndrome, indicating worsening ischemia that is not tied to exertion and potentially progressing to a myocardial infarction. While other options describe angina symptoms, pain occurring at rest is a hallmark of unstable angina and requires immediate attention. Always remember that pain occurring at rest, especially if it wakes a client, signifies a more serious and unstable cardiac event. Question 10. A postpartum client who delivered vaginally 2 hours ago is experiencing a steady trickle of bright red blood, despite a firm fundus at the umbilicus. What complication should the nurse suspect? A. Uterine atony. B. Retained placental fragments. C. Cervical laceration. D. Vaginal hematoma. Answer: C. Cervical laceration. The concept being tested here is identifying the cause of postpartum hemorrhage based on assessment findings. The key clues are steady trickle of bright red blood and firm fundus at the umbilicus. A firm fundus rules out uterine atony, which is the most common cause of postpartum hemorrhage but presents with a boggy, soft uterus. A steady trickle of bright red blood, despite a firm fundus, is highly indicative of a laceration to the cervix, vagina, or perineum, as arterial bleeding often presents this way. Retained placental fragments usually cause intermittent gushes of blood and a boggy fundus, while a vaginal hematoma would present with pain and a palpable mass, not necessarily external bleeding. Always correlate the type of bleeding and fundal assessment to pinpoint the cause of postpartum hemorrhage. Question 11. A client with type 1 diabetes mellitus presents to the emergency department with Kussmaul respirations, fruity breath, and blood glucose of 580 mg per deciliter. The nurse anticipates administering which type of insulin? A. NPH insulin. B. Glargine insulin. C. Regular insulin. D. Insulin aspart. Answer: C. Regular insulin. This question evaluates the nurse's knowledge of insulin types and their appropriate use in diabetic emergencies. The client's symptoms, Kussmaul respirations, fruity breath, high blood glucose, are classic signs of diabetic ketoacidosis, DKA, a life-threatening emergency. In DKA, rapid reduction of blood glucose and correction of acidosis are crucial. Regular insulin is the only insulin type that can be administered intravenously, making it the fastest-acting and most appropriate choice for immediate correction of hyperglycemia and ketosis in this acute setting. NPH and Glargine are longer-acting insulins, and insulin aspart is a rapid-acting insulin given subcutaneously, none of which are suitable for the immediate intravenous management of DKA. In emergency situations, remember that regular insulin is the go-to for administration. Question 12. The nurse receives report on 4 clients. Which client should the nurse assess first? A. A client with pneumonia with a temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius and productive cough. B. A client recovering from an appendectomy who is complaining of 6/10 incisional pain. C. A client with heart failure who reports sudden onset of shortness of breath and frothy sputum. D. A client with a urinary tract infection who needs teaching on antibiotic therapy. Answer: C. A client with heart failure who reports sudden onset of shortness of breath and frothy sputum. This question tests the nurse's ability to prioritize client care using frameworks like ABC, airway, breathing, circulation, or Maslow's hierarchy of needs. The keywords sudden onset of shortness of breath and frothy sputum indicate acute respiratory distress and potential pulmonary edema in a client with heart failure, which directly impacts breathing and circulation, ABC priority. This client's condition is unstable and potentially life-threatening, requiring immediate intervention. While the other clients have important needs, infection, pain, education, none represent an immediate threat to a vital physiological function as significant as the client experiencing acute respiratory compromise. Always prioritize clients exhibiting signs of acute respiratory distress or compromised circulation. Question 13. A client with cirrhosis develops hepatic encephalopathy. Which dietary modification is most appropriate for this client? A. High protein, low carbohydrate diet. B. Low sodium, fluid restricted diet. C. Low protein, high carbohydrate diet. D. High fiber, low fat diet. Answer: C. Low protein, high carbohydrate diet. This question assesses knowledge of therapeutic diets for specific liver conditions, specifically hepatic encephalopathy. Hepatic encephalopathy is caused by the accumulation of ammonia, a byproduct of protein metabolism, in the blood due to the liver's impaired ability to metabolize it. Therefore, a low-protein diet is crucial to reduce ammonia production and prevent further neurological deterioration. Carbohydrates are generally well tolerated and provide necessary calories. While low sodium and fluid restriction might be part of cirrhosis management for fluid retention, the primary dietary modification for encephalopathy itself is protein restriction. Remember, for hepatic encephalopathy, less protein equals less ammonia. Question 14. A client with acute kidney injury has a serum potassium level of 6.8 milliequivalent/L. The nurse anticipates the administration of which medication to rapidly lower the potassium level? A. Furosemide. B. Sodium polystyrene sulfonate, K-exalate. C. Regular insulin with dextrose. D. Calcium gluconate. Answer: C. Regular insulin with dextrose. This question tests the nurse's understanding of emergent hyperkalemia management. A serum potassium level of 6.8 milliequivalent/L is critically high and can lead to life-threatening cardiac dysrhythmias. Regular insulin administered intravenously, along with dextrose to prevent hypoglycemia, is a rapid-acting intervention because it shifts potassium from the extracellular fluid into the cells. While furosemide and sodium polystyrene sulfonate remove potassium from the body, they do so more slowly and are not the immediate solution for acute, dangerous hyperkalemia. Calcium gluconate helps stabilize the cardiac membrane but does not lower potassium levels directly. For acute hyperkalemia, think insulin and glucose for a rapid potassium shift. Question 15. A client with a cast on the lower leg reports severe pain that is unrelieved by opioids and describes it as burning and tingling. The nurse also notes pallor and coolness of the toes. These findings are most indicative of which complication? A. Deep vein thrombosis, DVT. B. Osteomyelitis. C. Compartment syndrome. D. Fat embolism syndrome. Answer: C. Compartment syndrome. This question assesses the nurse's ability to recognize the classic signs of compartment syndrome, a critical orthopedic emergency. The keywords severe pain unrelieved by opioids, burning and tingling, paresthesia, pallor, and coolness are the 5 Ps: pain, pallor, paresthesia, pulselessness, paralysis, though pulselessness and paralysis occur later, of compartment syndrome. This condition occurs when increased pressure within a confined space compromises circulation and nerve function, requiring immediate intervention to prevent permanent tissue damage. DVT would involve swelling and redness, osteomyelitis is bone infection, and fat embolism syndrome presents with respiratory distress and petechiae. Always be vigilant for the 5 Ps in clients with casts or fractures, as compartment syndrome is a medical emergency. Question 16. A school-aged child is diagnosed with varicella, chickenpox. The nurse educates the parents that the child is contagious until what point? A. The fever has resolved for 24 hours. B. All lesions have crusted over. C. It has been 7 days since the rash appeared. D. The child no longer has new lesions appearing. Answer: B. All lesions have crusted over. This question tests the nurse's knowledge of the infectious period for varicella, chickenpox. The critical point for cessation of contagion is when all the characteristic vesicular lesions have dried and formed scabs or crusts. Until every lesion has crusted over, the virus can still be spread. New lesions can continue to appear for several days, meaning the child is still highly contagious even if no new lesions have appeared in a day. Understanding this helps prevent further spread of the infection in schools and communities. Always remember, for chickenpox, crusted over means no longer contagious. Question 17. A client is admitted to the psychiatric unit after a suicide attempt. The nurse enters the room and finds the client attempting to tie a bedsheet to the window frame. What is the nurse's immediate priority action? A. Ask the client what they are doing. B. Stay with the client and remove the bedsheet. C. Call for assistance from other staff members. D. Document the observation in the client's chart. Answer: B. Stay with the client and remove the bedsheet. This question assesses the nurse's immediate priority in a critical safety situation involving a client at high risk for self-harm. The most crucial and immediate action is to ensure the client's safety by directly intervening to stop the dangerous behavior and remove the means of harm. Staying with the client ensures continuous observation and prevents further attempts, while removing the bedsheet eliminates the immediate ligature risk. While calling for assistance is important, direct intervention for immediate safety takes precedence. Documentation occurs after the immediate safety threat is managed. Always prioritize the client's physical safety above all else, especially in mental health crises. Question 18. A physician prescribes 1,500 milliliters of 0.9% normal saline to infuse over 12 hours. The drop factor of the manual 4 tubing is 15 GTT/ml. What is the correct 4 flow rate in GTT/min? A. 21 GTT/min. B. 31 GTT/min. C. 42 GTT/min. D. 52 GTT/min. Answer: B. 31 GTT/min. This question tests the nurse's ability to perform 4 drip rate calculations, a fundamental nursing skill. To calculate the drops per minute, GTT/min, use the formula total volume in ml/total time in minutes times drop factor, GTT/ml. First, convert 12 hours into minutes. 12 hours times 60 minutes/hour equals 720 minutes. Then, apply the formula 1,500 milliliters/720 minutes times 15 GTT/ml equals 31.25 GTT/min. When setting a manual drip rate, always round to the nearest whole number. Therefore, the nurse should set the 4 to infuse at 31 GTT/min. Mastering medication calculations ensures client safety and accurate medication delivery. Question 19. A client 2 days post-abdominal surgery reports severe pain and abdominal distension. The nurse assesses absent bowel sounds and no flatus. Which complication should the nurse suspect? A. Wound dehiscence. B. Paralytic ileus. C. Small bowel obstruction. D. Peritonitis. Answer: B. Paralytic ileus. This question tests the nurse's knowledge of common postoperative complications. The key clues are 2 days post-abdominal surgery, severe pain, abdominal distension, absent bowel sounds, and no flatus. These findings are classic indicators of paralytic ileus, which is a temporary cessation of intestinal peristalsis after abdominal surgery due to manipulation of the bowel and effects of anesthesia and analgesia. While a small bowel obstruction also presents with distension and absent flatus, paralytic ileus is much more common shortly after abdominal surgery and typically involves generalized absence of bowel sounds rather than localized obstruction. Wound dehiscence is wound opening, and peritonitis involves signs of infection and inflammation. Recognizing these specific signs helps the nurse intervene promptly to manage discomfort and prevent complications like vomiting and aspiration. Question 20. A nurse advocates for a client's right to refuse a blood transfusion, even though the nurse personally believes the transfusion is life-saving. Which ethical principle is the nurse upholding? A. Beneficence. B. Non-maleficence. C. Justice. D. Autonomy. Answer: D. Autonomy. This question directly assesses the nurse's understanding of core ethical principles in nursing practice. The concept being tested is respecting a client's right to make their own decisions about their healthcare, even if those decisions conflict with the healthcare provider's professional judgment or personal beliefs. The keywords advocates for a client's right to refuse clearly point to the ethical principle of autonomy, which is the client's right to self-determination. Beneficence, doing good, non-maleficence, avoiding harm, and justice, fairness, are also important principles, but autonomy specifically addresses the client's decision-making power. Always prioritize and uphold a client's right to choose, as long as they are competent to do so. Question 21. The nurse is planning a health promotion program for older adults in a community center. Which topic would be most important to include to prevent common health issues in this population? A. Safe medication administration techniques. B. The importance of regular physical activity and fall prevention. C. How to recognize the signs and symptoms of common childhood illnesses. D. Preparing for end-of-life care and advanced directives. Answer: B. The importance of regular physical activity and fall prevention. This question tests the nurse's understanding of age-appropriate health promotion strategies for older adults. While all options have some relevance, the most important topic for preventing common health issues and improving quality of life in older adults is regular physical activity and fall prevention. Falls are a leading cause of injury and death among older adults, and maintaining mobility and strength through physical activity helps prevent them. Furthermore, physical activity positively impacts numerous age-related conditions like cardiovascular disease, diabetes, and bone health. Always prioritize health promotion activities that address major causes of morbidity and mortality specific to the target population. Question 22. A client is admitted with a suspected ischemic stroke. The nurse understands that thrombolytic therapy, e.g., alteplase, is most effective if administered within what time frame from symptom onset? A. 6 hours. B. 12 hours. C. 3 to 4.5 hours. D. 24 hours. Answer: C. 3 to 4.5 hours. This question assesses the nurse's critical knowledge of time-sensitive interventions for ischemic stroke. The keyword is ischemic stroke and thrombolytic therapy, alteplase, which highlights the need for rapid treatment to restore blood flow to the brain and minimize damage. The most effective window for administering intravenous thrombolytic therapy is within 3 to 4.5 hours of symptom onset, depending on specific client criteria and guidelines. This narrow window emphasizes the urgency of recognizing stroke symptoms and seeking immediate medical attention. Early recognition and rapid transport are crucial for eligible clients to receive this potentially life-saving treatment. Question 23. A client is prescribed digoxin for heart failure. The nurse instructs the client to report which symptom immediately? A. Mild ankle swelling. B. Increased appetite. C. Yellow halos around lights. D. Occasional mild dizziness. Answer: C. Yellow halos around lights. This question tests the nurse's knowledge of digoxin toxicity and associated client education. The concept is recognizing adverse effects that indicate toxicity, which requires immediate medical attention. The keyword is digoxin, and the symptom, yellow halos around lights, is a classic visual disturbance characteristic of digoxin toxicity, often accompanied by nausea, vomiting, bradycardia, or dysrhythmias. While mild ankle swelling can occur with heart failure, and occasional dizziness can have many causes, yellow halos is a specific and serious sign of too much digoxin. Always educate clients prescribed digoxin to report visual disturbances, significant nausea, or a very slow pulse immediately. Question 24. During active labor, a client's fetal heart rate tracing shows late decelerations. What is the nurse's initial priority action? A. Administer oxygen via non-rebreather mask. B. Reposition the client to her left side. C. Increase the intravenous fluid rate. D. Notify the healthcare provider immediately. Answer: B. Reposition the client to her left side. This question assesses the nurse's ability to prioritize interventions for a non-reassuring fetal heart rate pattern in active labor. Late decelerations indicate uteroplacental insufficiency, meaning the fetus is not getting enough oxygen, often due to uterine contractions compressing maternal blood flow. The initial and most immediate action is to reposition the client, typically to the left side, as this helps alleviate compression on the vena cava, improving maternal blood flow to the placenta and thus fetal oxygenation. While oxygen, for fluids, and provider notification are also crucial, repositioning is the first and fastest intervention to attempt to resolve the issue at its source. Always remember to change the client's position first when dealing with late decelerations. Question 25. A client's arterial blood gas, ABG, results are pH 7.28, PaCO 255 mm of mercury, HCO3 24 milliequivalent/L. The nurse interprets these findings as indicative of which acid-base imbalance? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: B. Respiratory acidosis. This question tests the nurse's ability to interpret arterial blood gas, ABG, results to identify an acid-base imbalance. The concept relies on understanding normal ABG values and how they change with different conditions. Here, the pH is 7.28, which is acidic, normal 7.35 to 7.45. The PaCO2 is 55 mm of mercury, which is elevated, normal 35 to 45 mm of mercury, and indicative of a respiratory problem. The HCO3 bicarbonate is 24 milliequivalent/L, which is within the normal range, 22 to 26 milliequivalent/L, indicating no metabolic compensation yet. Therefore, an acidic pH with an elevated PaCO2 and normal bicarbonate points directly to uncompensated respiratory acidosis, where the lungs are retaining too much carbon dioxide. Remember, ROME, respiratory opposite, metabolic equal, is a helpful mnemonic for interpreting ABGs, and in this case, the pH and PaCO2 are moving in opposite directions.